So I'm Sophie, infant feeding specialist midwife. Can you see my name badge? There we go. Infant feeding specialist midwife based on the maternity ward here at Gloucester Royal Hospital. And I've got with us today, we've got Emma, so for the health visiting team, she's going to introduce herself, and Amy, a mum, one of the ThisMumCan mums champion. So Emma, do you want to introduce yourself?
So I'm Emma and I'm the infant feeding lead specialist health visitor, and I basically do the same sort of job as Sophie, who is introducing us within the health visiting service, and Sophie is working within the midwifery service. So we do work together a lot, don't we, Sophie?
We do indeed.
With supporting mums.
Yeah, that's right.
Yeah.
So I'm an extra layer of support to the midwives and our maternity support workers as well, MSWs. Just an extra layer of support, particularly for those mums experiencing breastfeeding difficulties, or if they've experienced breastfeeding difficulties in the past and they're anticipating, you know, they've got another subsequent pregnancy and they're worried about what might happen again. Our midwives and maternity support workers refer ladies into me. I provide additional support up until about 4 weeks old. We also have an infant feeding support midwife based on the maternity ward, Emma. So it's another Emma, so it does cause a little bit of confusion sometimes with colleagues. So generally between her and I, there is feeding support on the ward Monday to Friday. Generally when I'm off, Emma's in. When Emma's in, I'm off. It can be a bit like that. Best way of contacting us, I'll say that now, is the maternity ward. It's generally where we're based. There is a message book on the maternity ward. So the maternity ward numbers, which you should be able to find in your orange handheld notes. And I think they're going to be posted as part of this as well. I've just remembered something else I need to say. So just to let you all know, we're recording this session. So, if you don't give your consent, you would need to leave. But if you want to join, we assume you're happy for your consent for this session to be recorded. Are you all right with that, you two? Yeah, nods, great, thanks very much. I think I've given enough about me. So over to Amy. So this is Amy, one of our ThisMumCan champions, with one of her gorgeous daughters. You've got two little girls, haven't you, Amy? And Amy's going to introduce herself. Amy, if you also introduce yourself. Obviously your gorgeous daughters there, tell us their ages, a little bit about delivery, can be, if you're happy to, your birth stories, and also your breastfeeding journeys.
So I am 22, I have two babies under 2. I have Dolly, who will be turning 2 in October, and then I have Indy, who will be turning 1 in November. My delivery with Dolly was beautiful. I delivered her 5 weeks early, naturally. We're not quite sure why she was 5 weeks early, but she was fine and ready to come into the world, I suppose. The birth with her was great. I obviously didn't think it was that bad because I fell pregnant 3 months later with Indy. But Indy I was actually induced with, as I struggled a lot with so I struggled a lot with my pelvis. I was actually I was on crutches with Indy, and actually had to use a Zimmer frame to get to and from the toilet, and fell down the stairs a couple of times where my body just gave way. I'm pretty sure that's because I didn't recover from my last pregnancy.
You had them quite close together, which means they'll be the best of friends. But it does make it quite hard work when they're really young.
They have a lovely bond, but luckily I don't know any different. So
support, support is key, isn't it? Particularly when they're so young. But, support is key. Great.
I think I was very lucky with having my mum, who's a midwife.
Brilliant. So you had insider info. And how are you happy to tell us a bit about your feeding with them both?
Yeah, of course. So with Dolly, where she was 5'1" when she was born. She was very, very tiny.
Yeah, so little early. Yeah.
Her mouth was so tiny. Yeah, latching was a bit of a struggle to begin with. I think it is very easy to give up, but you know, perseverance is key. And a few weeks later, she was feeding beautifully. With Dolly, I did have to express into a syringe for a couple of days, just to top up her feeds. Just to top up her feeds, which was very difficult to try and express into a syringe. That was something I never thought I'd have to experience. But that was,
I think a lot
was
feel
a struggle.
like that.
It was a struggle, and I think especially when you first start feeding and your milk comes in a couple of days after. That's a massive shock to the system. Yeah, a massive shock. But I think once you get past those 2 weeks, where it is very difficult, it does become second nature. Now I don't really think twice about it, and it made it much easier with Indy. So when I gave birth to Dolly, I wasn't sure when to put her on and when was the right time to first feed her.
Were you encouraged with skin-to-skin contact?
I wanted to do skin-to-skin contact. That was something that I always wanted to do. So unfortunately, they did want to take her off of me to put her on CPAP. But she came out great, and she was screaming and using her lungs. So they did put her straight on me.
For those that aren't aware, that's something called positive airway pressure. So basically preterm babies sometimes just a little bit struggle with their breathing a little bit and just need some support with that. So it's kind of a device that creates positive airway pressure. We're doing a preterm feeding session this afternoon, actually, with Mel, one of the sisters feeding lead off neonatal. So we'll cover that more. That's great. Thanks, Amy. That's really helpful. So common feeding challenges that often can be experienced with younger babies, so babies under 4 weeks. Amy mentioned there about becoming really engorged. So you have colostrum, teeny tiny amounts of milk. I've got my teeny tiny tummy sizes. So I'm a bit of a props fan for those that are watching. I like a visual aid. That's just how I learn. So we've got teeny tiny tummy, newborn tummy, size of a small marble, about day 1. So it's purposely designed that way to that mums produce really small amounts of colostrum. In fact, I got some express milk syringes. So you might find yourself being supported by our maternity care assistants or midwives using one of these. It's a colostrum collector, it's called. So any preterm mummies are often encouraged to do it in labour if that's possible, if obviously pain relief and kind of circumstances are allowing. Any ladies being induced, if you know you are likely to have a complicated delivery, or if you're expecting to have cesarean section, there's lots of mums now do hand expressing into these tiny syringes. They're 1 ml syringes, but they are specially designed ones. So if it's something you want to do, or you want to talk to your midwife about, do talk to your midwife about it, and they'll be able to provide more information. But Emma, also, we talk about skin to skin for older babies, don't we? So skin to skin can be really good. So say you've got a 6-week-old baby that's having some breastfeeding difficulties. You talk about skin to skin as well, don't you, Emma?
Yeah, so skin to skin is really, really important, isn't it? Because it's really good for baby and for mum too. So with skin to skin, you get a nice rush of oxytocin as well, which of course helps with breastfeeding, but it also helps to make mum, feel a little bit better if she's feeling tired and things as well. And with baby, that's helping with the brain development. We could go on for hours talking about all these things.
Yeah, we could, couldn't we? We do, Emma.
Once we start talking about all the sort of skin to skin, it just goes on and on into all sorts of things, really, because I think skin to skin is what we always revert back to. If in doubt, revert back to skin to skin, really.
It's one of the
and that goes for older babies too.
Yeah. There's any mums out there difficulty? So I've supported mums before where they've got a 6-week-old, and some babies, if they've had a lot of bottles and lots of top-ups, you might have heard of something called the top-up trap. And actually we talk about a baby moon, don't we, Emma, where mums take to their bed, take to their sofa, something where they can just spend a lot of time doing extended skin to skin for a long period of time, enabling that baby to have access to the breast when he or she wants, without the pressure of kind of it specifically being a feed and without being forced. So babies naturally, once they're delivered, if we're kind of, it depends on how much we've had to intervene with the process, but generally once they've delivered, up onto mum's chest, there's a nice triangle area of mum's chest. There's loads of research shows it helps maintain their heart rate. It helps stabilize their heart rate is what I meant. Helps stabilize their temperature. It helps with bonding. It helps stabilize their blood sugar levels. So it's just all round really, really good for that mum and baby. If for some reason mum can't do it, if she's in a lot of pain using gas and air, dads can do skin to skin, or kind of birth, whoever the birth partner is. So if there's very close supporting grandma can do skin to skin, and just making sure the midwife or maternity care assistant would support you with skin to skin contact. So it's definitely one of our go-tos in our toolbox, isn't it, Emma, for feeding issues. Other common feeding issues, Amy talked earlier about engorgement. So your milk comes in around day 3, day 4, depending on what sort of delivery you've had. So typically with a vaginal delivery, you'd expect your milk to come in about day 3. Up until then, it's the teeny tiny amounts of colostrum, which we talked about, specifically designed that way. And then often your milk comes in if your baby's been feeding a lot or if you've been expressing a lot. And some people experience, or a lot of people, not everybody though, if they're feeding their baby a lot, but a lot experience something called engorgement, where your breasts get really hard. Full. They shouldn't get hard, hopefully, but very, very full, heavy. So here I've got 2 boobs here. They obviously look a bit, they're knitted boobs. I'm lost without a knitted boob, but often you get lots of lovely blue veins across your chest area, which indicates good blood circulation. But sometimes engorgement can mean the milk comes in and then it makes a baby that's been latching beautifully at the breast, then all of a sudden is struggling to latch. It's not soft enough and it won't give, so the baby comes off the breast, on the breast, off the breast. So there's something, Emma, have you heard of reverse pressure softening? It's one of our kind of go-tos at the moment. So reverse pressure softening can be a tactic. If you put it into Google, I love it, it's great. Emma uses it, so our feed and support midwife uses it lots on the ward with mums. So around day 3, day 4, day 5, whenever their milk's come in, so they've been doing lots of pumping or their baby's been losing lots of feeding. If you put it into Google, it comes up with like a info sheet on how to do it, but simply put in your hand. So I think it shows quite well on them. I've done it with mums before virtually. Putting your hand into a claw shape looks really distorted. My hand looks massive. And then that mum puts her fingers around the edge of the areola, presses into the breast tissue, holds it for 5 seconds, release, rotate around the breast, press into the breast tissue, hold it for 5 seconds, release. Generally doing it a couple of times and kind of rotating round, that mum should then find her milk start to drip, 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 drip. And what we've done, we've temporarily moved the swelling from the front of the breast tissue to further back in the breast. And then hopefully she can latch her baby on a bit better for a feed, and it should be able to feed. And once that baby really starts to feed with a good latch, get lots of milk, and then hopefully just carry on from there. But it can be particularly when you've got a very hungry baby that's crying his little heart out, and you just need to get on and feed. It's a really good, simple, but really effective tactic. So that's kind of one of the, I suppose, common feeding challenges you often find in those first few days. And similarly, latch. So getting that latch right, it is key. Often really common, did it myself, many of us do. Kind of, you just think, oh, they're on, they're feeding, I'm just going to stay there. It's a bit painful, but I'll leave them there. But actually, it's key to take them off, use a finger, don't just pull the baby off because they will cause nipple trauma. Use a finger to pop into the corner of the baby's mouth to pull that baby off the breast and try again. So nose opposite nipple. I know obviously you're not going to hold your baby in this position, but nose opposite nipple. And then hopefully that chin leading into the breast tissue and big wide mouth. Remembering this is a knitted boob, so obviously I'm not going to have huge amount of success, but indicators of a good latch. So here, if you have your baby, any of the birth units, all the birth units have got these, I call them cot cards, and the maternity ward's got them as well. Indicators of a good latch. I don't know if you can see that because it's probably gone back to front, but there's a series of cards basically on the cots. The kind of go-to guides. I'm looking at getting them put onto the Trust website, so hopefully they'll be there at some point as well. All your midwives, all the maternity support workers, all the maternity care assistants, we train them all, the feeding team train them with regards to feeding, and they should, they all know how to kind of support you in different positions and positioning and attachment of your baby. So your key being, you're looking for feeding cues. Here's my am with my visual aids again. So baby feeding cues, you should see that card around. For those feeding cues, they start to kind of do little bird thing. I often think of, and we often talk about, a little bird mouth with a wide open mouth. They will go towards a stimulus. So if you stroke your finger on their cheek, they will probably go for that finger. Or similarly, obviously, if there's a nipple there, they'll head towards it. The different reflexes that they have. Often babies are actually really good to feed. It says here about early cues. So actually, when they're first starting to wake up, then when they've first woken up from a sleep, they're in a quiet, alert state, and actually that's the optimum time to feed them. So if you're thinking nap change, I want to get myself a drink, I need to get the phone, actually just get on, and if you can, just get on and feed your baby. Obviously make sure you've had a wee, or kind of thinking about the next feed, when she's likely to next feed. Actually, I might go and have a wee, I'll get my water bottle. So kind of being prepared. So we often, don't we, Emma, talk about mums being prepared with a little feeding area. If they're at home, a kind of particular chair, I had part of the sofa that I loved sitting in. I had the coffee table to my left. I had water bottle with water in. I had remote control. I had my phone, tissues, muslin. Sometimes the pump, because I had to do a bit of expressing as well. So kind of everything you need before you sit down and feed. Yeah. Would you agree, Emma? Kind of that? Kind of getting into a pattern.
Some nice healthy snacks as well, isn't it? You know, if you keep some nice healthy snacks on there as well, because you often forget to feed yourself, don't you? When you're feeding baby, you'll often forget to feed yourself. So if then you're sat feeding and you think, oh my gosh, I can't move now, and actually I've just remembered I haven't eaten, at least you've got some snacks there ready, haven't you?
I do know people that, and I did do this for a bit actually, I know people that the night before, or their husbands would make packed lunches. So then say if you know, oh, it's like got to lunchtime, because with newborn baby and sleeping and feeding and everything, you kind of forget about yourself a bit. And actually, if you can just pull something out the fridge that actually it's packed lunch, or you've got a lasagna cooking in the oven, and you can just grab a bag of salad out. Got to be chopping, cooking, preparing, all that kind of thing. Get your get your partners involved, get your families involved. In this current weird world we're living at the moment, people can drop off lasagnas, spaghetti bolognese, all of that on your doorstep, that kind of thing of utilizing your kind of your resources as to what you can in this weird and strange world that we're in. So we've talked about engorgement, talked about latch positions. So this is another one. I would say daily we talk about different positions, don't we, Emma? So I'm going to try and show you on with my camera. Cross cradle hold. Hopefully you can all see that. So I'm supporting the baby around the nape of the neck with my the kind of palm of my hand, my thumb uppermost, my finger there. So by doing that hold, my baby's body is in line, my arm is in line, and I've got the baby's bottom under my elbow like a set of bagpipes, if that makes sense. That baby's head is free. I'm not doing this, that kind of position. You're still supporting the head by doing that. Doing this, I often sometimes imagine trying to eat your lunch with someone's hand on your head. That'd be quite off-putting. So if you can, just kind of get into that practice of holding behind the nape of the neck. So that's cross cradle hold. Rugby hold is kind of that one. So that's your classic rugby hold. So the baby, you can see actually quite well in that picture, the baby's in that position. Just talking positions, Amy. And then upright rugby ball, I call it, where the baby's uppermost, the body's kind of alongside my body. A new favourite of mine and my colleagues. Can I show you? My baby's a bit little, so I'm going to get a different baby because I've got a preterm baby and then I've got a term baby. So my term baby, this is a koala hold. So heads almost, it does take support with obviously your midwife, health visitor, maternity care worker, etc. Lay back feeding position. So imagining I'm laid back. You probably can't see this very well on camera there. My baby's laid back. My dolly's my baby's on my chest. That can be a really nice one actually for one. So if your baby's had forceps spontaneous delivery, sorry, the tablet's falling down. Got it all happening today. Technology, don't you love it? There, laid back feeding position. And then we sometimes, this is one that often people look at a bit strange, something called dangle feeding. Have you heard of dangle feeding, Amy? Oh, we can see. And
can you hear me?
Yes, we can hear you.
Oh
hello.
my gosh, finally connection.
Nice to have you back.
Thank
I've just
you.
been chatting about different positions. Did you find any particular positions difficult, easy?
I think the rugby ball.
Yeah, brilliant.
That was best when I first had Dolly. Yeah, where she was so tiny, it was easier to hold her in that position and was easier to latch her.
That's like mine.
Yeah, I found with Indy, just normal position or koala position.
Yes.
Dolly likes the koala position now. It's much easier for her. But I think once you get the hang of latching and actually feeding, it's. I think every position will be easy once you've mastered latching.
Would you say did you find in the beginning getting the hang of just one position and getting the latch sorted in one position before you then practice with other positions? Yeah, so I always thought that this position now was going to be the easiest way to get them on, which I find so when that's they the most that's a cradle hold. I didn't find it. Yeah, but I didn't find it easier. I found the rugby ball easier. I found in cradle position, when the nipple's in their mouth and when they're so small, the rest of the boob covers their nostrils. And there was a fair few times that I'd be feeding and I'd be watching the TV and I'd look back and realise that it was covering their nostrils and I'd have to move it and they would take a deep breath. So I found so rugby position was a lot easier. So cradle hold is that position. I'm not showing it brilliantly, but often with that one, your elbow often ends up tilting the head up into the breast tissue like that. It's interesting because it's the most instinctive for mums, so they naturally naturally find they do that. But in actual fact, if you're going to do it, it's a case of moving your arm along. I'm aware of time. I don't know what we're doing on time, but Emma, moving on to older feeding challenges of older babies.
I'm just asking Amy now, I think, about positions, because I'm aware that when I'm talking to mums about different positions, what might have suited perhaps as a position early on doesn't suit when the baby is older, bigger.
Sure.
What do you think about that, Amy? Have you experienced that? What would you say about that?
Yeah, no, I agree. I definitely agree. I think when they are smaller, it's easier to get them in more comfortable positions for yourself and for them, because they can't get themselves in a comfortable position. It's down to you to do that. Whereas when they get older, they can then move around and get themselves into position and find what's better for them. And I find when they are older, when they're able to get on their knees and when they're moving around a little bit more, when led in bed, it's easier for me to lay on my back and they they get on their knees and they hop on and find their own position.
But so Amy, you just described a laid back. So actually that's a really good one for newborn babies. Well, any age really. It can be a really good one because they lay back and the mum's body supports that baby's body and naturally encourages the head to tip back. So it's a position I love. I've done it quite a lot. I've run the tongue tie clinic and I've done it quite a lot after babies that are quite bothered and distressed after tongue tie. I've had some, it's a bit like Marmite, I found. People either love it or hate it. So I've supported a lot of ladies doing that position and it's worked well, but I myself didn't get on with it, which is interesting. But there's many things like that, isn't there, Emma?
And I think I think it's all very individual as well, isn't it? About what positions are going to suit mum and baby. And
absolutely.
I think it is about supporting mums try different positions
Yes.
throughout the journey as well, because one of the times I might have a phone call is actually when the baby gets older and the position that they're using now perhaps is causing soreness, and actually it's just because they need to change the position, and that position doesn't actually suit anymore because the baby's grown. Sometimes, you know, it is experimenting, but still, you know, going forward with those basic principles of position and attachment. So holding baby close, head free to tilt back, nose in line with the nipple, and all the head, body, shoulders in alignment, which when they get older, they start to twist about, don't they? And they do their own thing, which if it's going well, then that's fine. But
you've reminded me, Emma, as well. So I supported somebody recently who was tandem feeding, and toddlers can be, they can do a shallow latch, can't they? And it's almost like your nipples actually, it's not that they toughen up. So there's an old wives' tale of your nipples toughen up. It's not that they toughen up, they become more elastic. So your nipples stretch up to 2 centimeters as part of breastfeeding, and the hormones of breastfeeding actually just make them stretchier. So often I've seen toddlers that you think, oh, that's a really shallow latch. And I've supported a mum recently, and actually she was letting her newborn baby do a similar latch, almost like he was bottle feeding, because he had really pursed lips and really shallow on the end of the nipple. And because she'd been feeding the other one, she was like, oh, it's fine, you know, not really doing anything. And actually her baby ended up coming in with a weight loss around day 3, day 5, because it hadn't been effectively stripping that breast of the milk with the wide latch, which is what you're looking for, that big wide latch, which there's pictures. And staff can support kind of with identifying a good latch. Emma, is there anything else kind of on the more older baby? I'm just trying to think common feeding challenges for older babies.
I often do get the question, how long should I breastfeed for? And actually, as long as you want to, and as long as your baby wants to continue, because the benefits are absolutely fantastic, aren't they? And, you know, it's not only about the health and nutrition side of it, it is about the emotional side of it as well. It's that connection, and it's the soothing as well. So I'm sure, Amy, that you found situations where actually the breast was really, really good for just soothing baby as well. So I don't know, anything, appointments, anything at all that you have, immunizations, anything like that is really useful. Do you have any examples of when you've sort of think, right, I'm just gonna, you know,
so immunizations, every time we went for injections, I would start feeding baby before they had the injection. And then I found that when they had the injection, they cried for a couple of seconds, but they went straight back onto the boob for comfort. And especially with Dolly, my eldest, she twiddles her fingers with my other nipple as comfort. So when she's so there's times where she feels anxious. For example, she feels shy and she'll put her hand down my top and have a feel.
I know I've known of others that do that. Oh, hair's the other one.
This one plays with the hair. But I found that when Indy was born, tandem feeding them and letting her dolly feed whilst Indy was still on, it built a bond with them, because she thought, well, nobody else does this with mummy, nobody else gets to feed from mummy. So it obviously meant a big thing that there was somebody else feeding from me. Chicken pox, Dolly had chicken pox, and it was a dream being able to feed her. It soothed her mouth straight away. She's had hand, foot and mouth before. It's not affected her mouth where she's fed. And
I've known of babies or mums have reported back to me actually that their GP or the doctors said to them, actually, your baby, if you weren't breastfeeding, your baby probably would have been ended up admitted. Actually, they've maintained breastfeeding, maintained fluids that way. They've stopped eating and all the other things, but actually they've maintained breastfeeding. And one mum I kind of know, she actually, her supply increased again because the toddler was big so much, and then she had to try and kind of manage that again.
Same here.
It's amazing. it's amazing source of
it's amazing stuff. Yeah, it's amazing stuff. I think people think that breast milk is just to feed them. It's really not. We've had, for example, a family member of mine, my nephew, he was really struggling with hand, foot and mouth. He couldn't drink anything at all. He couldn't eat anything.
Yeah,
he was losing weight due to it. And I actually expressed some milk for him. Yeah. Put it in the fridge so it was freezing cold. He drank it. He had that about twice, and his ulcer started to clear up after just two rounds. Wow. Yeah, and I also think with sticky eye, I think, you know, as newborns, sticky eye is so common. I find breast milk is like gold dust when it comes to sticky eyes. Yeah, there's a lactation consultant in Australia, and she shares this article of like, I can't remember, it's like 28 uses of breast milk. Because of the natural antibacterial properties and all the goodness in it. There's a good website, is it Human Milk for Human Babies, isn't it, Emma? I think that does like an advert, so a breast milk advert that highlights what's in breast milk and the benefits. Yeah. I'm just kind of thinking other common challenges. So tongue ties often get bandied about at the moment. I know somebody, well, my auntie, she gave birth 5 weeks after I had Dolly, and he had a tongue tie. And so she struggled to latch for the first few days, and it was really just it was really sad for her because she was so desperate to breastfeed. And luckily she took him in and caught it early on, and they snipped the tongue. Brilliant. And good. You got to see. She said that as heartbreaking as it was to see him get his tongue snipped. It was a dream after, and she ended up breastfeeding until he was over a year old. So great. They had a really lovely journey after that. Yeah. And for any of those mums out there, if it is something you're kind of worried about or struggling with, obviously speak to your midwife or health visitor. We have clinics that run at Cheltenham and Gloucester, and your health professionals need to refer you into that. There is various symptoms that I suppose that kind of can highlight. But yeah, if you're having a kind of a complex feeding journey, do ask them to refer. So obviously, depending on the age of your baby, if your baby's under 4 weeks, it would be to myself, or we've got Emma on the ward as well. So we've got the message book on the ward. I mentioned about that earlier. For babies over 4 weeks, their health is just can refer to Emma below. Often kind of other common feeding challenges I tend to see in the kind of early weeks, we tend to see rather than my kind of the whole team really, all the midwives. Weight losses can be quite common in the beginning, so it can be common in first babies. And some babies just they have a bit of a weight loss, so up to 10% is kind of thought to be completely normal. Babies, term well babies, lay down brown fat on their backs purposely to burn off in those early days of when mum's establishing milk supply. And so up to 10%, we're not usually very concerned about. Over 10%, we sometimes put a plan in. Well, we do. Our policy is that we follow a plan and put a plan in place to encourage that mum to express. So expressing is one of the first go-tos, skin to skin and hand expressing in a kind of, certainly my kind of area of the field. And certainly Emma, who's based on the ward, she says it as well. It's the answer. It's our first go-to for a lot of feeding issues, skin, skin and hand expressing, and encouraging that mum to give that express breast milk. Your midwife or your maternity support worker should be able to support you with giving that express breast milk, either via syringe or via cup, depending on what day it is and what volume it is and things like that, and then putting a feeding plan in place. There's lots of things actually for weight loss, isn't there, Emma, that we talk about breast compressions. Once your milk's in, something kind of where you squeeze your breasts. There's some good videos on YouTube about breast compressions, expressing, getting that mum expressing to really maximise her milk supply. The key being in that first skin to skin can really help, but also that first feed after birth. So your midwife or maternity support worker, maternity
care assistant on the delivery suite or on the birth unit, wherever you are, should support you with those first few, the first feeds in the early days. If that baby has a good first feed, it sets up your baby really, really well. If for some reason your baby has to go around to neonatal, we encourage hand expressing. We'll talk more about that this afternoon. And kind of, yeah, so positioning baby for feed. Any tips, Amy, on those early days, latching wise?
A hacker, you know, I don't know if you've
pump.
seen that was honestly the most amazing thing for me. I found that putting it on one whilst I was feeding on the other side, where you've got all that excess milk, and you leak and they're oozing out, and it's so uncomfortable. It's having the hacker feels it's more of a relief because it helps draw it out faster. And I was getting, I think it holds 4 mils. I think it holds 4 mils per hacker. So I 4 ounces, not mils. So I would get 4 ounces, if not more, each time I fed from both sides. Oh wow,
amazing!
So I was really lucky with my supply. So I would then just put it into a bottle, and it would be.
That's one of the ways. It's one of the kind of many tactics we talk about. The hacker pump, or kind of, you can get Aldi, Lidl, one of those two, do a cheaper brand as well.
They actually have them in Aldi at the moment for £1.99.
Yeah. So they're cheaper. They work by suctioning. They effectively suction onto your boob. So Amy, you've just described kind of, you get lots of milk leak out during a breastfeed. There's multiple letdowns. At the very beginning, there's a big letdown, but as your baby carries on feeding, there's more letdowns where you kind of get a gush of milk in a way, and that pump makes the most of that, so it captures those letdowns. So it's a really good tactic for mums, particularly if there's mums struggling with expressing, they're needing to top up their baby because of a weight loss issue. It can be a good tactic. The key being, obviously, you then need support. We're kind of positioning one, getting the baby on, and then trying potentially a rugby ball hold on one side while you pump on the other side. Yeah, it's a really good. We get a lot of mums support those really positively.
I found that they worked better than an actual machine for me. I'm not quite sure why, but it did work better for me. But I also found when using it, if they was in cradle position, the amount of times that I would have the hacker on one side, baby on another, and then the hand would come up and knock it down, and I would lose all the milk. That happened quite a few times.
You're right in that, actually. So with expressing as well, it's a really personal thing. So where one mum gets on well with a hacker pump, another one might get on really well with hand expressing. So some mums actually find, once they've got the technique of hand expressing, so there's a good link. If you Google baby friendly initiative hand expressing video, that's the one I direct people to. Some people find actually they can hand express really fast and really, really well. Use like you, Amy, kind of using hacker pump. I kind of myself with mine, I got a hospital grade pump, thinking brilliant, right, here we go, off I go. And actually I got more volumes off with a hand pump, because we're talking pre-hacker days. The hacker wasn't around then. I got more volumes off with a hand pump itself, and doing breast massage, so massaging your breast as you pump, kind of pressing those, because your milk ducts are kind of way back here, pressing as you pump. That actually really worked well for me, and I got more off doing the hand pump and that rather than doing the double electric. So it is a really personal thing. So I would urge anyone out. Very different ways of expressing and pumping. My colleagues just come to the door to distract me as well. Anything would you add to that with expressing, Emma?
I think that's a really useful one that I talk to mums about, is actually expressing off one side while you're feeding off the other if you can. Because you do have a letdown on both sides, and it is more time saving as well as perhaps getting milk that way. Because it can be quite difficult if you're feeding off one side, then feeding on the other, and then expressing afterwards. And by the time you've all done that, you're starting again. So that can be quite time saving from doing that. And I think there's also like cluster pumping as well, isn't there? That's there's a nice infographic description of that on the Milk Meg as well.
The Milk Meg,
For
yeah,
power
I showed
pumping
some
and
on that
cluster
yesterday.
pumping, those kind of terminology words that lots of people talk about. That again can help with milk supply, but also help with, it takes longer to do maybe that session, but you may have done it all in that session. So, you know, and then you can do that when you are able to. So I think hand expression, again, it's like everything else that we talk about. It's very personal, and it's very much what's going to suit that mum and baby, isn't it? About routine, as in, you know, when is it going to be best for you to pump? Can you pump with every feed or after every feed? You know, do you need to? And, you know, do you want to? It's all about individual sort of situations, isn't it? And what's
and also
is it going to be hand expression? Is it going to be an electric pump?
The key, similarly with breastfeeding, latch wise, the first 30 seconds can be a bit toe curling, and most mums do describe that as toe curling, and then that eases. Would you agree, Amy, to that?
Yes.
So, certainly in the beginning, in the early days. Yeah.
Oh yes, definitely in the beginning. And I also find that one of the biggest challenges, going back to the ducts, the milk ducts.
Yeah.
I was never aware that you could get blocked milk ducts, and I would sit there with a pain and think, oh, there's a pain in the side, and all you'd have to do is just press that one side, and it would release.
Supported a few ladies with this recently and found, however you're expressing, whether it be by hand or by pump, you shouldn't be getting sore. It should not be painful. And if it is, something's not working. So do ask your midwife, your maternity support worker, health visitor, somebody, nursery nurse, to support you with, and just make sure you're doing the technique right. So with hand expressing, here's my knitted boob again. Thumb and finger in a C shape. Do lots of breast massage with a warm flannel, warm hot water bottle, warm bath, warm shower, whatever works. Kind of massaging the breast tissue, and then a thumb and finger in a C shape on the edge of the areola, about 2 to 3 centimeters away back from the breast, and pressing into the breast tissue and release. If you're doing the technique right, you shouldn't get sore, and if you are, stop is generally the guidance. Similarly with a pump, if you're using a pump and find you're getting sore from a pump, you shouldn't. So it could be actually the pump size, the funnel part of it isn't the correct size, but again, your midwife, health visitor, or the feeding team can support you with kind of sorting that out. So don't hesitate to get in contact or ask to be referred. But yeah, that can be, so when they're really sore, that can be a good time to be expressing. I remember my community midwife with my first, I got astronomically sore, and actually it's a case of, we use a quote, don't we, Emma, of what it's Oprah Winfrey, I love this quote and I use it all the time, as does Emma. When you know, you do your best with the knowledge you have at the time. When you know better, you do better. And that kind of really resounds with a kind of a lot of people. I got really sore in the first few days after both my babies, and the midwife said to me I could rest my nipples from breastfeeding but carry on expressing, and they heal really, really quickly in 24, 48 hours. In that time, I carried on pumping, let the nipples rest, and they healed really quickly. And then you kind of feel almost a bit like, right, I can do this again now, because you can get to a point where some mums find they're really tearful, it's just too painful, oh my goodness me, and you're starting to dread a feed. If that's the case, obviously seek support. We've got the fabulous groups out there as well, so GBSN, BFN, which are going to come on to a bit more into that session's on Friday, but you can get support through them. So their options I'll list about on Friday, and their websites are very good as well for the contact details.
So I'm just going to ask now, because I know we're sort of running out of time. There's so much we could talk about. If Amy, your babies still sleep, you know, do they sleep at night? Do they feed at night? And have you ever experienced them going a longer time without feeding suddenly, where you have got perhaps very full or blocked ducts or anything like that, and how you perhaps managed it?
So at the moment, I'm actually going through a bit of a rough patch at night time, where both of them want to be in my bed and both of them want to be feeding from me. Because we're on holiday at the moment, and whilst we're away and we're in a different scene,
holiday does
Yes, so they are currently
Different
both sleeping in bed with me on this holiday, and both feeding at night time. And I do find it is very challenging to feed at night time, especially when you're so tired yourself, and you're feeding throughout the day, which is tiring enough, and then having to do it through night as well, especially with two, when they both want to be on at once. That is a challenge in itself. I find that when I've had blocked ducts, I find what's worked better for me is sleeping on my side and feeding from my side.
Yeah, brilliant.
I find it releases where the mattress is pressing against one side, and then you can massage the inner side of the boob whilst they are feeding. I find that helps massively. Rather than laying on my back and letting them feed on top of me, because it's not really drawing it out. And I also find that the koala feeding position is very helpful when you've got blocked ducts, because it's almost like gravity's helping release. Absolutely. Laying on my back has never worked when I've had blocked ducts. And I find sounds so awful, doesn't it? But playing with the nipple and trying to draw it out and
massage it. Yes, you're basically trying to massage the area,
but also kind of pulling it a little bit, if that makes, like with your two fingers, and which that
in our training
sometimes even now 2 years into breastfeeding, that still happens, and sometimes I have to sit there and I just have to draw it out, and it does take a while, but then you feel that pop. It's almost like a pop and a release. And it's so
you sound like you've had some people get milk blebs, so they get I'll probably show you better one, a blockage really shallow in the nipple, and milk backs up. I'd never heard of it till I experienced it myself, and it came out like, it reminded me of stringy cottage cheese is how I've described it. And you, like you say, you get a pop and release. It's weirdly a little bit like a whitehead spot, isn't it, Amy?
Yes. Oh my gosh, and that's my favourite thing. That's one of my favourite things. So yeah, I get great pleasure out of doing that. And I do find what you did then with all fingers and thumb and drawing it out. Yeah, it does get all on your hand and it is messy, but
if it releases the pain,
that is because you're all around it, not in just one bit with your finger and thumb. I do think that the whole hand does help massively. It really does.
Talking about sleep as well, so I don't know if have you heard of the lullaby? So there's a couple of really good resources, isn't there, Emma, that we refer, so staff obviously know about, and they cover in their classes and in part of the kind of follow-up checks, postnatal checks and stuff. So there's basic baby sleep information source. They used to be called ISIS. They've obviously changed the name to BASIS. You can understand why. And Lullaby Trust. So those are two websites. Any mums out there struggling with any kind of feeding and sleeping, particularly sleeping, really, issues, wouldn't you say, Emma? Those two websites are worth going to look at. They've got lots of resources, videos, leaflets on kind of typical newborn sleep, and actually it's really, really common. Babies have got tiny tummies. It's a protective mechanism that they sleep short periods and they wake frequently, and it's a case of utilising your support options and seeing what is available to you, one to kind of so you can cope, and also kind of utilising the support networks in this weird world that we have. Emma, did you want to add anything before I think we're due to finish shortly. Ladies, do you want to add anything to finish us off? Silence.
I think it's been really helpful having Amy here to talk from a real perspective as well, isn't it? Because
giving real life,
we sort of talk from our professional thing, which is fine, but it's also nice to see how that works in reality as well, doesn't it? I think it is really, really valuable to have somebody like Amy here to be able to talk to us about what it's really like for you and how you actually manage it. With any sort of challenges that you've had, and actually how to overcome them, and how much you're enjoying it as well.
Yeah.
Oh yeah, with all the challenges that come with breastfeeding, there's not a single thing that I would change about it. I've absolutely loved every second of it.
Oh.
Looking back when I first started, you know, it's hard to love something that's so painful and so difficult. But once you have got through that stage and you look back, and it's a really rewarding feeling actually to know that you've been able to do that for your child, and the bond that comes with it is something that I can't even explain to anybody. And I think every journey for everybody is completely different. Just because one person struggled doesn't mean the next will. Just because somebody's had a smooth ride doesn't mean that the next person will. But
yeah, absolutely.
I think it's all to do with the beginning, and it's all to do with those first couple of weeks where it is difficult. You just have to get through that. And I think people feel very pressurized into breastfeeding at the moment as well, don't they? Because it's almost like if you don't breastfeed, you're not doing the right thing. Where I think it isn't a very nice feeling for people to feel that. And I think that if you're not passionate about it, and if you really don't want to do it, then forcing yourself to do that isn't a good idea, because then you're stressing yourself out and you're releasing hormones that the baby, it's not going to be good for the baby anyway. And I think it's something that you have to want to do.
Yeah. Well, thank you very much, Amy.
Thank
you, Amy, for chatting to us today. It's been really helpful. Managed to get there in the end with all the virtual IT.
I know, sorry about
issues. No, it's fine. Don't worry. It's the new world we live in now. I think Emma and I kind of got used to it, haven't we, Emma? Thanks, Emma, for joining me. Hopefully it's been useful for everybody. And it's just a note to say, I think ThisMumCan are going to make sure the contact details for the feeding team who are based on the maternity ward, and for the health visiting team with regards to feeding issues, contact numbers will be attached, is from what I understand. So thank you very much, ladies. And
no problem.
Take care. Thank you. Bye, everyone.
Bye.